the last time you looked in your medicine cabinet? If it's been a while, now's probably the right time to add it to your spring cleaning checklist. Joining us today to talk about the do's and the don'ts of what should be in your medicine cabinet, as well as the essentials, is Dr. Allyson Marsh with Cone Health Community Pharmacy. All right, so first and foremost, let's just start off with this. Expiration dates, because so many of us are going to open up our cabinet and we're going to look at all these things with expiration dates. Should they be our guide as what to keep and what to get rid of?
That's a great question. And I feel like that's one that we often get as pharmacists is expiration dates. What do we need to go by? Knowing that that expiration date is really how we can tell that a medication is still effective. Once it's past that expiration date, really and truthfully, the medication likely is ineffective. There also, on the flip side of that, there could be a chance that the medication past the expiration date could even become harmful. Now, this is a bit more rare, but best case scenario, the medication's not effective for what you're trying to treat. Worst case scenario could actually cause more harm than benefit.
So throw
definitely
it
follow
out.
those. Yes, okay. Exactly right.
Got it. Loud and clear. We wanted to make sure that we got that. There's no wiggle room in there. Okay. Do the rules about expiration dates differ between prescriptions and over-the-counter medications?
That's a great question. So no, expiration dates are going to be the same across the board. Really, the only difference we have when we think of over-the-counter and prescription is the amount of monitoring that's required by your healthcare provider. So regardless of the medication, if it's expired, go ahead and throw it out.
All right, so expired stuff, we're throwing it out. Besides those expired meds, what else should we be removing from our medicine cabinets?
That's a good question. So thinking of maybe you had a medication like for your blood pressure, your doctor adjusted what your medication you're on, maybe they changed the dose, any med that you're no longer taking. Another instance could be maybe you had a procedure or a surgery recently, had a pain medication that was prescribed, you're no longer needing it. A lot of times I think patients feel that, oh, I want to kind of keep my medications, hoard them just in case I ever need them. And it's better to be safe and just go ahead and get rid of them if you're no longer using them. You can always get it filled again. So if you end up needing it.
Then let's think about this. So we need to throw that all out. How do we safely throw it out or dispose of it?
That is a really good question that we also get a lot of times as pharmacists. So if you have medications you're no longer needing, the best way to dispose of them is to take it to either a drug drop-off box, or there's different things called our drug disposal days that are put on by the DEA. So oftentimes there will be pharmacy involvement, local law enforcement involvement, and this typically will take place twice a year. So those are two different ways you can do it year-round at one of your local community pharmacies or local law enforcement agencies, or through a DEA drug take-back event.
Okay, I'm guessing that the common mistakes that we make when we get rid of medications are we throw them in the garbage, we put them down the toilet, down the drain.
Yes, you know, more often than not, I think when I was growing up, I remember learning to just dispose of medications down the drain or flush them down the toilet, put them in kitty litter, that kind of thing. And really and truthfully, our sanitation system isn't really equipped to kind of break down those chemicals that are within medication. So no, that's not ideal. What would be ideal is to take them over to your local community pharmacy. And it's really great. Cone has these drop-off boxes within each of their 6 community pharmacy locations. So you can go right into the waiting room and drop them off there. You can also go to conehealth.com/drug disposal if you want to see where some other drug disposal boxes are kind of within your area.
Okay, and so those disposal boxes, we don't have to like fill out any forms. We don't have to talk to anybody about it. Explain why we have the medication.
No, absolutely not. So no one's going to go through it or look at the different things. The most important thing is not everything can go in a drug disposal box. So medications in terms of pills, tablets, capsules, those can go within a drug disposal box. Sometimes I recommend to patients maybe they want to pull off their personal information, your name, date of birth, that kind of thing from the pill bottle, but that's safe to go inside. What you don't want to put inside would be things like needles, syringes, or possibly inhalers. So really sticking to our tablets and capsules.
Okay, so now that leads me down the other question, right? So what about if we have needles or inhalers or whatever? I know it's just like one question after another, but what do we do with those then?
It is, yes. So, inhalers, once they're used, those can be disposed of in the trash. Just taking off, at least on the box, take off your name, your personal information before disposing of that. But needles and syringes, we definitely don't want those to go in the trash. You can buy a sharps container from really like a local pharmacy, medical supply store. They even sell them online on Amazon, and they're relatively inexpensive. I personally would recommend that for a couple of reasons, one of which is the hard plastic material that they're made from helps prevent puncturing on the outside of the box. Another reason is when you buy those, they have instructions for how you can properly dispose of them. So who to call, they'll take them, that kind of thing. If that is not an option for you and you absolutely have to dispose of it right then and there, I recommend like a old detergent bottle, anything that's not clear so patients wouldn't see, or other people maybe digging through the trash wouldn't see what it is. Fill it up and then you can duct tape that lid closed and dispose.
What are the essentials that we should all consider keeping in our cabinet?
Absolutely make sure that you have a working thermometer. You'll always need that. Medication for pain and fever, so Tylenol, ibuprofen, making sure you have allergy medications on hand, and especially if you have people that do have allergies to medications or food, have an up-to-date, not expired EpiPen. And some of those as needed albuterol inhalers are good things to also keep on hand.
Okay, now if we have like kids, tweens, that kind of stuff, what additional items should we have in that medicine cabinet?
That's a good question. So definitely for little kids, they have specifically with like our fever or pain medications like Tylenol, ibuprofen, they have child specific doses, and they come in liquid because so many kids can't swallow tablets or capsules. So that's important to keep on hand. I also recommend making sure all medications are stored high, maybe using, some of those safety clasps on your cabinets. Really, all medications that you get, whether over the counter or prescriptions, should have safety caps on them, and just be sure to keep them in those safety cap bottles to help prevent our kids from getting into them. So.
All right, now you mentioned if we got kids to put those up high. Here's now what I want to ask, because you've always had a medicine cabinet in your bathroom, but is inside your bathroom where you should be storing your medicines?
No, you often think of the house that has, when you walk into the bathroom, that little cabinet behind the mirror. Well, that's not the ideal place to store it. We want to store medications just generally anywhere outside of a place where it's going to be humid. So the bathroom is not ideal. That can be bedroom, kitchen, whatever it might be, but not the bathroom.
Right, because you're taking showers, you're steaming things up and all that other kind of stuff, and it can actually change the medication.
It can. It absolutely can. So.
Okay, so now that the cabinet's cleaned out, it's stocked, it's organized, how often should we be doing this?
Really, I would say I go by twice a year. So if you time it up with daylight savings, you can just do it that way. You're already making changes around the household, resetting your clocks. Go ahead and clean out your medicine cabinet.
Okay, and is it something, do I have to be like totally organized, like have everything like written like what we have, or a list of just what I take on a regular basis?
You don't have to be totally organized necessarily. One thing that I recommend is you can get little stickers, and if you have medications that are going to be expiring within the next 6 months, you can put a little sticker on it and say this expires in December or whatever it might be. That way, at least in the interim period between cleaning them out, oh, my Tylenol is going to expire. I don't want to take this after this time period. So.
Gotcha. Okay. And then how important is it to share your medication with like your provider? And that includes your pharmacist. I think sometimes we kind of don't think about that.
That's very important, especially if you have multiple providers or maybe you get medications from multiple pharmacies. It's really important that every single healthcare professional that's involved in your care knows each and every medication that you're on. And because so many medications interact with each other, can interact with different foods, disease states, whatever it might be, I recommend for patients to have a little typed up list that they keep maybe in their wallet of the medications they're currently on, and making sure that they provide that to every healthcare professional that they interact with.
Great. All right. Thank you so much for your time and your expertise. And now we're all challenged to go clean out that medicine cabinet. If you missed any of this, this is going to be in the To Your Well-Being section of our website.